All right, so I got a story here that is really just yet another reminder of the broken nature of our privatized healthcare system here in the United States, what the solutions are to actually fix the problem. So I got an article here from the New York Times that is basically expressing how this problem with medical debt here in the United States, which is honestly, in my opinion at least, a phrase that should not exist in a functioning society. Medical debt is apparently even larger, almost twice as large as we had previously thought. So Americans' medical debts are bigger than was known, totaling $140 billion. And we're going to get to this in a minute in this piece, but that's not actually the entire number. This is just very specifically what debt collectors are focusing on. So a new study finds that healthcare has become the country's largest source of debt in collections. Those debts are larger where Medicaid wasn't expanded. So they kind of frame this entire article and discussion about our healthcare system here in the United States surrounding expanding Obamacare and expanding basically like subsidizing some of these other programs that do give people more access to health insurance. But if you've watched my videos or you know any leftists who discuss these things, access to healthcare is not the important factor here. We need people to actually have the ability to have healthcare as a human right so that they don't face the risk of bankruptcy, so that they don't have ridiculous co-payments, premiums, deductibles, etc. Providing more access to millions of more people is, a good step in the right direction, but it's nowhere close to actually solving the antagonisms and the actual underlying problems of why Americans are getting ripped off generally. So they frame this article in an inaccurate way, and we're going to get to that. But Americans owe nearly twice as much medical debt as was previously known, and the amount owed has become increasingly concentrated in states that do not participate in the Affordable Care Act's Medicaid expansion program. New research published Tuesday in JAMA finds that collection agencies held $140 billion in unpaid medical bills in 2018, the most recent year that data is available. An earlier study examining debts in 2016 estimated that Americans held $81 billion in medical debt. So again, it's twice as much as what they had previously anticipated this number should be. But we're talking about collection agencies. We are talking about medical debt that has been purchased by these debt collection agencies that they are then holding to then go shake down Americans to end up paying it. So we're just talking about a very small specific subset of the total of American debt in American medical debt. But still, I mean, this is just such a perverse system. The fact that this is even an industry at all is disgusting, right? That you have a debt collection agencies that are going and shaking down Americans to pay for life-saving medical costs. It's just an absolutely perverse system. And they continue, including what this doesn't actually include in these totals. The $140 billion in debt does not count all medical bills owed to healthcare providers because it measures only debts that have been sold to collections agencies. The increasing number of lawsuits that hospitals file against patients to collect debt, which can lead to legal fees or wage garnishments, are not included in the figure, nor are the medical bills that patients pay with credit cards or have on long-term payment plans. Some of the difference between the new estimate and the older, smaller one may reflect differences in how credit rating agencies categorize debt. So again, this is just a small fraction of the total medical debt. So while $140 billion seems ridiculous, that's barely scratching the surface. And so here's where we get to how they actually frame this article. They do mention Medicare for All down here. They mentioned Bernie Sanders and how he has suggested a single payer system as a solution, but they really only mention it in one paragraph, and they cover the rest of it with things that other corrupt Democrats have been putting forward, like giving out handouts to these health insurance companies, etc. And so here's how they frame this issue. Medical debt is unlike other kinds of debts because people often cannot choose whether to incur it. Okay, right? A poor person may choose to buy a less expensive car than her richer neighbor, but if she has a heart attack and needs surgery, she will get a bill just as big as her neighbor. So it seems like they kind of get it, right? They get it, but they don't get it. Medical debt is unlike other kinds of debts because you can't control it, right? So it's almost like we should take that idea and then use it to justify a system that says, hey, maybe you shouldn't be punished in regards to your healthcare, determined by what's in your wallet. Maybe we shouldn't be stratifying a healthcare system based on how much money you have to pay for certain procedures. Maybe we shouldn't be throwing Americans into ridiculous debts for the crime of getting sick or needing healthcare. And not only that, but the thing that they don't mention in this article and that they never mention in these mainstream discussions is that we are paying more than every other developed nation in the entire world for our healthcare system. And here's the data on this. So US per capita healthcare spending is almost twice the average of other wealthy countries. So here you see the United States up there at about $11,000 per capita here. And you compare that to even just the next highest one. Switzerland is $7,700, Germany $6,600, and you go down and down. What is the common denominator here between all of these ones that are less expensive than us is all of those other countries have some variation of a single payer system. Now, they don't mention that in the New York Times article. Again, they never mention that in any of the conversations surrounding this, but we are the only country in the entire world that does not have, in terms of OECD developed nations, that does not have some variation of a single payer system. So we are just directly allowing Americans to get fleeced by these health insurance companies that exist for literally no purpose other than to price gouge Americans and prevent them from getting the access to the healthcare that they actually need. So the solution to this is a single payer system where we all pay in. It would be cheaper collectively to do that and eliminate health insurance companies altogether, and have the government stand in as the single healthcare insurance provider, and then you get access. You can go see whatever doctors you want, and you never have to pay any copays, you never have to pay any premiums, you never have to pay any deductibles, and you don't have any risk of bankruptcy. It's a significantly better system. The data proves that. Even just basic logic and understanding how this system is working proves that. And the entire reason why we can't move towards a single payer system is for this reason. So if you go and look at the leading lobbying industries in the United States, okay, what sits at the top there? I mean, even more than our defense industry, even more than all of these other massive perverse industries that we have here in the United States that are throwing lobbyists to go and bribe our government officials, what sits at the top? Pharmaceuticals and health products at 306 million. So this is where we're at right now in terms of who is bribing our government. The healthcare and the pharmaceutical industries stand above every single other thing. So you take politicians like Joe Biden, you take politicians like the Joe Manchins of the world, the Mitch McConnells of the world, all of these conservative politicians, they are all being bribed to deny you healthcare. That is the dynamic that is going on right now, because the solution is as obvious as it could possibly be. Again, all you would have to do to understand the problems with our healthcare system is go look at every other developed country around the world that have figured this out, right? Go look at the Canadian healthcare system, which is not perfect by any stretch of the imagination, but it at least, they don't have the same costs that we are incurring. They aren't slapping that down on the poorest and most vulnerable Americans. They don't have a system where everyone is exposed to bankruptcy all the time. And it's just a significantly more efficient and better and cheaper system that provides healthcare to everybody. But again, the reason we can't do this is because we have corrupt politicians who are taking bribes from these gigantic health insurance companies, these big pharmaceutical companies, and they're taking those bribes to then go and deny you healthcare. So the New York Times obviously is never going to talk about that in an honest way, so that's why we have to talk about it in an honest way and continue to push this idea that a single-payer system is the solution in the meantime, and then eventually moving towards something closer to the UK system and actually nationalize our healthcare system and big pharmaceutical industries altogether. So those are the solutions. It's very obvious what needs to be done. We need to continue to keep calling out these corrupt politicians who are standing in the way of you and your doctor, you and your healthcare. And yeah, I mean, articles like this that just show how ballooned this American debt that we have had in something that shouldn't even be a category that exists in debt in a functioning country. I mean, these articles should be an expose on exactly why we need to move as aggressively as possible towards a Medicare for all single-payer system.